Good morning. Welcome to Patho. Today we're going to be discussing Chapter 7, Immunity. The immune system is responsible for the body's defenses, protecting the body against pathogens by triggering immune responses. Specific and non-specific immune responses are the two types of immune responses triggered by the immune system. And the main difference between specific and non-specific immune response is that specific immune response protects the body against specific pathogens. Non-specific immune response is the same for any pathogen that enters the body. A nonspecific immune response refers to the immediate protective response of the immune system, which does not require previous exposure to an antigen. In a specific defense, the immune system is responsible to particular substances, cells, toxins, or proteins that are perceived as foreign to the body and therefore unwanted or potentially dangerous. This response helps recognize and remove things from the cells, tissues, and organs that we don't want in the body. In a specific immune response, we have antibodies and lymphocytes. These are the key elements. The lymphocytes will possess surface receptors and secrete certain proteins that can specifically bind to the antigens. Those secreted proteins are called antibodies. The binding of the antibodies into pathogens helps destroy those pathogens. Immune responses that occur after the first introduction of the antigen are usually going to be more rapid and more intense than the initial response. The second line of defense is a non-specific immune response. This is initiated when a pathogen enters into a tissue. Cells like the macrophages, natural killer cells, monocytes, neutrophils, mast cells, and dendritic cells will serve as phagocytes to destroy the pathogens inside the tissue. Inflammation, fever, histamines, and complement proteins are all part of the non-specific immune response in the second line defense of the body. If you look at the illustration here in a nonspecific immune response, the mast cells detect the injury to the nearby cells. The mast cells then release the histamine to initiate the inflammatory response. Histamine will increase the amount of blood flowing to the wound or the site and bring in phagocytes and other immune cells that will neutralize the pathogens. This influx of blood causes the wound to swell, turn red, and become warm and painful. Cytotoxic T cells, helper T cells, and B cells are three types of lymphocytes that help trigger a specific immune response. These cells generate either humoral or cell-mediated immunity. Specific immune response refers to an immune response against a specific antigen, and it is the third line of defense. And you need to know the difference between these two. The immune system has several cells that have different roles and functions. It prevents the body from becoming infected by pathogens through physical and chemical barriers. The physical barriers like skin and chemical barriers such as stomach acids and enzymes are located in different cells. The immune system can directly destroy cells through the T cells, which are matured in the thymus. Neutrophils help kill bacteria and fungi, while eosinophils kill parasites and invade those cancer cells. Lymphocytes attack viruses. They have a role in antibody production. And then the mast cells and the natural killer cells invade bacterial infections and tumors. Remember, your mast cells also release that histamine. Plasma cells produce antibodies that attack foreign antigens. The immune system also consists of lymphoid structures, immune cells, tissues, and chemical mediators. The lymphoid structures include lymph nodes, the spleen, the tonsils, interstitial lymphoid tissue, the lymphatic circulation system, and these form the basic structure within which the immune response can function. The immune cells, lymphocytes, macrophages provide the specific mechanism to identify and remove foreign material. Tissues involving immune cell production and development include the bone marrow and the thymus. Immune cells originate in the bone marrow, and the bone marrow and the thymus have roles in helping those cells mature. During fetal development, the thymus programs the immune system to ignore self-antigens. The body may attack its own tissue as non-self, causing some of the autoimmune disorders. The blood and the circulatory system provide the transportation and communication network for the immune system. Chemical mediators include chemicals such as histamines and interleukins that help play a major role in the body's immune reaction. Structures of the immune system. First, let's talk about the thymus. The thymus produces T cells. T cells circulate through the body to invade infectious foreign antigens. Antigens are any foreign substance that stimulates the immune response to produce antibodies against them. Bone marrow is a source of our stem cells, leukocytes, and mature B lymphocytes. Bone marrow has a main role in the synthesis of red blood cells, white blood cells, and platelets. White blood cells play a key role in immunity. White blood cells are then classified into neutrophils, eosinophils, basophils, monocytes, and lymphocytes. Each one of these cells has a specific role in protecting us against invading pathogens and diseases. B cells are another type of immune cell that are produced and matured in the bone marrow. B cells have antibodies on their surface, and these antibodies act against the antigens. The lymphatic tissue and the organs. These contain many lymphocytes. They help filter fluids in the body. They help remove foreign material, and they are part of the immune response. The lymph nodes is a bean-shaped structure found in various regions throughout the body. Lymph nodes filter lymph from the foreign bodies, and they help produce lymphocytes to attack against the foreign bodies. The tonsils are a pair of soft tissue found near the pharynx. Tonsils help prevent foreign bodies from entering the lungs. The skin covers the entire surface of the body and acts as the first barrier and defender. The skin has important immune cells such as Langerhans cells. The spleen is about the size of your fist. It's the largest organ in the immune system, and it has a role in getting rid of old and damaged red blood cells. It also stores and filters blood, making white blood cells that protect you from infection. Antigens are foreign substances or human cells that are unique in each individual except in identical twins. They're usually made of complex proteins or polysaccharides or a combination of glycoproteins. They activate the immune system to produce specific antibodies. These specific antibodies are produced by the B lymphocytes. Antigens representing self are present on a person's plasma membranes. They are coded by a group of genes inherited from our parents. These are called major histocompatibility complex, and they are located on chromosome 6. Due to the large number of combinations that are possible, it's unlikely that two individuals would ever have the same antigens, with the exception of identical twins. One of the main steps in adaptive immunity is recognition of the antigens by the immune cells so that they're able to induce a specific immune response against that antigen. The B cells can recognize the antigens without external help, while T cells only recognize antigens presented to them that are attached to the cell on the surface. The major histocompatibility complex has an essential role in activation and regulation of the immune system and cell-to-cell communication. Major histocompatibility molecules are used in detecting changes in the cell membrane altered by a virus or cancer, and they alert the immune system to their presence. The human major histocompatibility complex is known as the human leukocyte antigen, abbreviated as HLA. These antigens also provide the close match for tissue transplants. The immune system will be activated by the presence of different cells with different major histocompatibility molecules. The immune system generally tolerates self-antigens on its cells, so no immune response is initiated against its own cells. In autoimmune diseases, there's an exception in which the immune system no longer recognizes itself from non-self and it starts to attack its own cells, structures, or organs. Antigens themselves are chemical markers located throughout the body that help identify cells or molecules. Antigens will induce an immune response on the part of the host organism. Sometimes the antigen can be part of the host itself. These are the major histocompatibility complex antigens, also called leukocyte antigens or human leukocyte antigens, HLA. Major histocompatibility complex antigens are tolerated by the body's immune system. Foreign antigens will be destroyed. These antigens are usually exogenous substances. They present themselves on the cell surface, such as proteins, polysaccharides, and glycoproteins. The macrophage is critical in the initiation of the immune response. Macrophages come from monocytes. Macrophages are present throughout the body in tissue like the lungs, the liver, the lymph nodes, and they're very large cells that intercept and engulf foreign material, and then they process and display the antigen from the foreign material on their cell membrane on the surface of it. The lymphocytes respond to this display to initiate the immune response. Macrophages will secrete chemicals such as monokines and interleukins, and these play a role in activating other lymphocytes and in the inflammatory response, which accompanies a secondary immune response. The primary cell in the immune response is the lymphocyte, produced by the bone marrow. Immunocompetent cells are mature lymphocytes. These cells have a special function of recognizing and reacting with antigens in the body. The two groups of lymphocytes are B lymphocytes and T lymphocytes. They determine which type of immunity will be initiated, either cell-mediated immunity or humoral immunity. You have to know the difference. B lymphocytes or B cells are responsible for humoral immunity. This is through the production of antibodies or immunoglobulins. B cells mature in the bone marrow and then proceed to the spleen and lymphoid tissue. After exposure to antigens with the assistance of T lymphocytes, B cells become antibody-producing plasma cells. B memory cells provide for repeated production of antibodies upon exposure, known as the humoral immune response. So B lymphocytes, humoral. Cell-mediated Immunity develops when T lymphocytes recognize antigens on the surface of a target cell and directly destroy the invading antigens. So cell-mediated T lymphocytes. These T lymphocytes come from the stem cells and they're held in the bone marrow. Then they travel to the thymus for further differentiation and development. These specially programmed T cells then reproduce to create an army and battle the invader. They also activate other T and B lymphocytes. T cells are primarily effective against virus-infected cells, fungal and protozoal infections, cancer cells, and foreign cells like we find in transplants. There's a number of types of T cells marked by different surface receptors. Each has a specialized function in the immune response. Cytotoxic CD8 positive T killer cells destroy target cells, binding to the antigen and then releasing damaging enzymes or chemicals. These monokines and lymphokines release and destroy foreign cell membranes. They can cause an inflammatory response. They attract macrophages to the site. They stimulate the proliferation of more lymphocytes, and they also stimulate hematopoiesis. Phagocytic cells then come along and clean up the debris. Helper CD4 positive T cells promote the immune response. The memory T cells stay in the lymph nodes for years, ready to activate the response again if the same invader returns. Two subgroups of T cells have gained prominence as markers in patients with acquired immunodeficiency syndrome or AIDS. T helper cells have CD4 receptors on the cell membrane, and the killer T cells have CD8. These receptors are important in T cell activation. CD8 positive killer cells are primarily cytotoxic. CD4 positive T cells regulate all immune function. The B and T lymphocytes, macrophages, and natural killer cells by secreting messenger cytokines. HIV destroys the CD4 positive cells and cripples the entire immune system. The ratio of CD4 to CD8 positive cells is normally 2 to 1. This is closely monitored in people infected with HIV as a reflection of their progress or the progress of the infection using a technique known as cytometry. B lymphocytes or B cells are responsible for humoral immunity through the production of antibodies, immunoglobulins. B cells mature in the bone marrow and then they move on to the spleen and the lymphoid tissue. After we are exposed to an antigen with the assistance of the T lymphocytes, the B cells become antibody producing plasma cells. Natural killer cells are lymphocytes distinct from the T and B lymphocytes. They destroy without any prior exposure or sensitization tumor cells and cells that are infected with viruses. A person must have been exposed to a specific foreign antigen and developed specific immunity to it, such as antibodies, before this defense is effective. Immune responses that occur after the first introduction of the antigen are usually more rapid and intense than the first response, destroying foreign material by nonspecific defense mechanisms such as phagocytosis and the inflammatory response. By removing the foreign material, the immune system also plays a role in preparing injured tissue for healing. Individuals often develop cancer when the immune system is suppressed, as with an infection or increased stress. Not all cancer cells are identifiable as foreign, and the immune system may not remove them. The immune system directs the response to the antigen, but also has built-in controls to prevent excessive responses. Two limiting factors are the removal of the causative antigen during the response and the short lifespan of the chemical messengers. Tolerance to self-antigens prevents improper responses. Tolerance means that the immune system ignores the self cells. That's what we call demonstrating tolerance, is when the immune system ignores self cells. There are a number of chemical mediators like histamine and cytokines, and these help with the immune response. These chemicals have a variety of functions, such as signaling cellular responses, or they can cause cellular damage. Unique antigens, often proteins of someone's cells, that person's immune system can distinguish the self from the non-self and detect and destroy unknown material. Usually, our immune system does ignore self cells. When the immune system recognizes a specific non-self antigen as foreign, it develops a specific response to that particular antigen and stores that information in its memory. It's similar to a surveillance system, warning of an attack, and the subsequent mobilization of an army for defense. For example, lymphoid tissue in our pharynx, such as tonsils and adenoids, can capture antigens in material that is inhaled or ingested and process the immune response. Cytokine storms can be triggered by various infections and non-infectious agents, but especially by viral infections like H1N1 influenza and severe acute respiratory syndrome coronavirus 1 and coronavirus 2 or COVID-19. Cytokine storms also are referred to as hypercytokinemia. This is a physiological reaction by the immune system that involves uncontrolled and excessive release of cytokines. The most common clinical condition associated with that cytokine storm is going to be acute respiratory distress syndrome. There are two types of immunity, humoral and cell-mediated. The humoral response is mediated by B cells producing specific antibodies to a particular pathogen. In cell-mediated immune response, it's T cells responsible. The cytotoxic T cells cause lysis of the infected cells. Both B and T cells will produce cytokines during specific immune responses. Invasion of a pathogen often triggers both cell-mediated immunity and humoral immunity. Cell-mediated immunity again involves T cells effective against pathogens in the cell like viruses or fungi, malignant cells, and grafts of foreign tissue. A T cell response occurs when cytotoxic T cells attack the altered cells. Helper T cells often join the attack, and so do memory T cells to retain knowledge of the pathogen for future encounters. With humoral immunity, it mainly involves B cells, sometimes assisted by T cells. Humoral immunity involves antibody production, and it's effective against extracellular pathogens like bacteria. It can also protect against viruses or fungal infections by immobilizing the bacteria. The antigen is labeled for phagocytosis by the macrophages or the neutrophils. The antigen-antibody complex can also activate the complement cascade. The complement cascade is a group of several plasma proteins that circulate in the blood until activated by bacteria or an antigen-antibody complex. Activation will result in lysis of the cell. Complement proteins bind to foreign antigens and label them to attract macrophages. The immune process begins when a phagocyte, such as a macrophage or a B cell, ingests an antigen. The phagocyte, called an antigen-presenting cell, displays fragments of the antigen on its surface, a process called antigen presentation, and this alerts the immune system that we have a foreign antigen present. When the T cell spots the foreign antigen, it binds to it. This activates or sensitizes the T cell, and it begins to form identical T cells that are already sensitized to the antigen. Some of these T cells become effector cells, such as cytotoxic T cells and helper T cells, and these cells will carry out the attack, while others will become memory T cells to remember the antigen for future encounters. The cytotoxic T cell binds to the surface of the antigen and delivers a toxic dose of chemicals that will kill it. Helper T cells support the attack, secreting the chemical interleukin, which attracts the neutrophils, the natural killer cells, and the macrophages. It also stimulates production of the T and B cells. Antibodies, also called immunoglobulins or gamma globulins, are glycoproteins produced by plasma cells in response to foreign antigens. Antibodies don't destroy the foreign antigens, but they attach themselves to the antigen and label them for destruction. Your body creates new antibodies whenever it's infected with a new antigen. If the same antigen infects you a second time, your body quickly makes copies of the corresponding antibody to destroy it. These brave soldiers only live for a few weeks, so it's a good thing there's a lot of them. Each antibody is specific for only one antigen. B cells produce millions of different antibodies. There are 5 classes of human antibodies designated by their letter names: IgG, IgA, IgM, IgD, and IgE. Antibodies can also neutralize viruses by attaching to the virus and making it unable to enter the cell. Viruses cannot reproduce outside the cell. Those coated with the antibodies are phagocytized by the macrophages. Antibodies are also part of the allergic response process, where the immune system responds to a foreign but harmless antigen like plant pollen. IgE antibodies bond to mast cells to break down and release histamine and other chemicals that contribute to inflammation. Anaphylactic shock is an allergic reaction, but massive in response. It's characterized by loss of plasma from the capillaries, an effect of the histamine, and a sudden drop in the blood volume and the blood pressure. Antibodies are a specific class of proteins called immunoglobulins. Each immunoglobulin or antibody has a unique sequence of amino acids that help it bind to an antigen and attach to the macrophage. Antibodies bind to the specific matching antigen and destroy it. Specific immunoglobulins may be administered to treat diseases such as Guillain-Barré syndrome, an autoimmune disease that attacks the peripheral nervous system and causes progressive paralysis. The complement system is activated during an immune reaction with IgG or IgM class immunoglobulins. Complement involves a group of inactive proteins that circulate in the blood. Activation of the complement system eventually results in destruction of the antigen by lysis when the cell membrane is damaged, or by some complement fragment when it attaches to the microorganism and marks it for phagocytosis. Complement activation also initiates the inflammatory response. IgG is most commonly found in blood. IgM is the first that usually we see increases in the immune response. IgA is found in things like our secretions like tears, saliva, mucous membranes, and colostrum. And that's that first milk that mom lets down with the baby. IgG, immunoglobulin G, also known as gamma globulin, is the main immunoglobulin in blood, lymph, cerebrospinal fluid, and perineal fluid. IgG is able to cross the placental barrier and provide protection to the fetus and newborn. IgM is an antibody made by B cells. It's the first class of antibiotics produced when we have an infection. All other classes are produced later. IgA is found in secretions like tears, saliva, mucous membranes, and colostrum, and it provides protection in that colostrum for the newborn child. IgE is a vital part of the immune system. In type 1 hypersensitivity reactions, those that occur immediately in response to an allergen. It involves IgE antibodies and leads to release of inflammatory mediators like histamine, from the immune cells. This causes symptoms such as a runny nose, known as allergic rhinitis, swollen itchy eyes, rash, and anaphylaxis. High levels seen on an IgE test might indicate presence of an allergic reaction to some environmental or dietary allergen. We also may see presence of a parasitic infection or presence of a viral infection. IgD is mostly expressed as a B cell receptor, but it's also found in blood and body secretions in small amounts. IgD is found on the mature B cells, mostly in the spleen, lymph nodes, some of the mucous membranes, and the tonsil. Secreted IgD produced by the plasma cell in small quantities is found in blood and upper respiratory mucus, in the nasal passages, tonsils, salivary glands, and lungs. It's also found in the mammary glands, the middle ear, and the tear ducts. How much would you be willing to pay a security firm to protect you 24 hours a day for 365 days of a year? This incredible service is provided by your immune system, which is the system that recognizes and destroys foreign invaders. When your immune system responds to the presence of foreign invaders, we call it an immune response. Your immune system is a valuable asset and selflessly protects you from many different foreign invaders, which we call antigens. When you have antibodies present in your body fluids that provide immunity, the immunity is called antibody-mediated immunity. This is also called humoral immunity. Remember, humoral immunity, B cells, antibodies. The other immunity is cell-mediated immunity, which is when special cells, T cells, provide immunity by ridding the body of unwanted cells like infected cells, cancer cells, or transplanted cells. With this type of immunity, we see cells called macrophages, which engulf antigens. The term macrophages is easy to recall if you break down the word. Macro means big, suffix means phages, so here we're talking about big eaters. They have an insatiable appetite for antigens, and after they eat the antigen and chew on it, it will present the antigen's fragments on its outer surface. Special white blood cells called T helper cells help these macrophages send out signals that call different cells like cytotoxic or killer T cells into the battle. The killer T cells rapidly divide and develop into this army of cells that's ready to fight and destroy the unwanted invading cell that triggered that immune response. So just review this table. It's from your book, okay? And look at the function of everything in there. Where does it come from? How does it work? What does it do in the body? A complement group of inactive proteins is in circulation, and when activated, it stimulates the release of other chemical mediators to promote inflammation, chemotaxis, and phagocytosis. The complement system is frequently activated during the immune reaction with IgG or IgM class immunoglobulins. Again, think of that army trying to protect and defend a specific territory from an enemy. Once the enemy is spotted in the territory, the army has to buckle up and eliminate the enemy. The complement system is similar, with a series of proteins in the body that circulate in the blood and tissue, waiting ready to eliminate the invading pathogens. These proteins are inactive and they get activated by the pathogen, like bacteria or a virus that has invaded the body. These proteins mainly complement the role of other immune cells, and that's why they're named complement. These proteins are named according to the time of discovery, and a letter C is used to represent each of them. They are named from number 1 to 9, C1 to C9. A number of chemical mediators such as histamine and cytokines may be involved in the immune reaction depending on the particular circumstance. These chemicals have a variety of functions such as signaling a cellular response or causing cellular damage. Histamine is released from the mast cells. I would know that. And basophils. Okay, so both the mast cells and basophils, particularly in allergic reactions, causing vasodilation, increased vascular permeability or edema, contraction of the bronchial smooth muscle, and pruritus. Histamine can help dilate blood vessels by stimulating the production and release of relaxants of smooth muscles of the blood vessels. It also binds with the endothelial cells of the blood vessels to start the contraction. This contraction results in a vascular leak. As the allergens enter the body, they're recognized by IgG. So allergies and allergies and IgE go together. The IgE antibody is present on the B lymphocyte specific for that allergen, and that will produce the memory plasma cell. The mast cell in the tissues and the basophil in the bloodstream have the receptors for the IgE antibody where the specific IgE needs to bind. When the allergen enters the body a second time, the antibody IgE present on the surface of the mast and basophil cells bind with the allergen, and this binding causes degranulation of the basophil cells and the mast cells, leading to release of that histamine into the body. Histamine is then going to produce the symptoms of the allergic reaction. The other chemicals like leukotriene and cytokines are also released, which cause an allergic reaction. When the histamine is released into the lungs, it causes wheezing due to inflammation in the airway. In the nose, the histamine causes nasal secretions, sneezing, and itching. Cytokine messengers. This includes the lymphokines, the monokines, the interferons, the interleukins produced by the macrophages, activated by the T lymphocytes, stimulate activation and proliferation of the B and T cells and start that communication between the cells that happens during inflammation, fever, and leukocytosis. So, for instance, have you ever rolled your ankle and it became swollen? Have you ever gotten the flu or had a cut that became infected? If you've had any of these, then you've experienced situations where the cytokines are functioning in your body. Cytokines are often called messenger cells because they take a message with them as they go throughout the body. Once they bind to the cell's surface receptor, the cytokine will give the message to the cell. For example, the cytokine could give the message to increase inflammation and pain in a certain area in the body, like when the person sprains their ankle. Cytokines are very small, non-structural proteins secreted by various cells in the body, and they function to help regulate the inflammatory and immune response. Many of the cells that secrete cytokines are white blood cells like lymphocytes or monocytes. White blood cells are immune cells that protect the body from pathogens and infections. Antigens are small particles usually expressed on the surface of a cell that the immune system uses to recognize whether a cell is dangerous or not. For example, an antigen might be a piece of protein sticking out of the cell wall of a bacteria. Normally, the immune system ignores self cells, demonstrating tolerance. When the immune system recognizes a specific non-self antigen as foreign, it develops a specific response to that particular antigen and stores that response in its memory for future reference. Non-self antigens are exogenous or external antigens. They are particles of something the immune system recognizes as not part of the body it protects. bacteria, viruses, food, ingredients, pollen are all examples of things that the immune system could recognize as non-self. When the immune system recognizes a non-self antigen from a pathogen, this is called an immune response to an infection. Self-antigens are endogenous or internal antigens, and they're particles that the immune system recognizes as part of the body that it does protect. A heart cell, a blood cell, a liver cell, or a brain cell. Examples of things that the immune system could recognize as self. The ability of the immune system to differentiate between self and non-self antigens is called self-non-self discrimination. By removing the foreign material, the immune system also plays a role in preparing injured tissue for healing. When the plasma membrane of neoplastic cells is abnormal, the immune system may be able to identify these cells as foreign and remove them, playing an important role in the prevention of cancer. It's also been noted that individuals frequently develop cancer if the immune system is depressed, like in an infection or with increased stress. This slide represents some physical and anatomical barriers. I would take a close look at it and be familiar with it. A titer measures levels of serum immunoglobulins. It's a test used to determine if a person has been vaccinated or if the vaccine is still effective in a person. The titer measures the level of antibodies to a certain disease in the person's blood. If a particular level of antibodies are present, this means the person is immune to the disease. The indirect Combs test detects Rh blood incompatibility. Indirect Combs tests are used to measure a specific antigen called Rh in pregnant women. If a woman with Rh negative blood gave birth to a child with Rh positive blood, a condition known as Rh sensitization may occur. There may be a blood reaction here. During the indirect Combs test, red blood cells are checked for antibodies that may be floating in the fluid portion of the bloodstream known as the plasma. The enzyme-linked immunosorbent assay, also known as ELISA, helps detect HIV antibodies, and it's also used for a number of other diseases. The major histocompatibility typing helps us match tissues before we do a transplant procedure. The major histocompatibility complex is a group of cell surface proteins. They're encoded with the MHC proteins, and in the immune system, they present antigens to immune cells, and they help distinguish self from non-self. This is known as antigen presentation. The MHC molecules help enable the immune system to recognize a diverse range of antigens, including tissues and organs transplanted from another organism. And one of the main steps in immunity is antigen recognition by the immune cells, so they're able to induce a specific immune response against this antigen. The B cells can recognize the antigens without external help, while the T cells only recognize antigens presented to them that are attached on the cell surface to that molecule. An additional value of the MHC is its role in recognizing the cells in the body as self. Except for identical twins, there are no two individuals with identical sets of MHC. There should be a minimal degree of differences between the MHC molecule of two individuals to maximize of a graft being transplanted so that it's not rejected by the immune system. The organs transplant Before the organ's transplanted, the MHC proteins have to be matched between the donor and the recipient tissues. Natural immunity is species specific. For example, humans are not usually susceptible to infections contracted by other animals. Innate immunity is gene specific and related to ethnicity, as evidenced by increased susceptibility of North American indigenous people to tuberculosis. Active immunity develops when the person's body develops antibodies or T cells in response to a specific antigen introduced in the body. This process takes a few weeks, but the result usually lasts for years because memory B and T cells are retained in the body. A primary response occurs when we're first exposed to an antigen. The antigen is recognized and processed, and subsequent development of antibodies or sensitized T lymphocytes begins. This takes 1 to 2 weeks and can be monitored by testing with antibody titers. Following the initial rise in the seroconversion, the level of the antibody falls. A secondary response happens when a repeat exposure to the same antigen occurs. This response is going to be much more rapid and results in a higher antibody level than the primary response. Even years later, the memory cells will quickly stimulate production of a large number of matching antibodies or T cells upon exposure. The primary immune response is our immune system's first line of defense against a pathogen. It's a non-specific response of immune cells, mainly phagocytic cells. The secondary immune response is the immune system's response to a pathogen it's previously been exposed to. This response uses T and B cells, and it's quick and efficient. It uses memory and specificity. Antibody titers. Bacteria are not measured directly, but are determined by measuring antibodies that are targeted to a specific antigen. Active immunity develops when the person's body develops antibodies or T cells in response to a specific antigen introduced in the body. This process takes a few weeks, but usually the results last for years because of the memory B and T cells retained in the body. Active natural immunity may be acquired by direct exposure to an antigen. For example, when a person has an infection and then develops antibodies. Active artificial immunity develops when a specific antigen is purposefully introduced in the body to stimulate production of the antibodies. For example, a vaccine solution containing dead or weakened organisms that stimulate the immune system to produce antibodies but does not cause the disease itself. Passive natural immunity occurs when antibodies are transferred from one person to another, like from mom to baby, across the placenta, or through the breast milk, providing protection for the infant for the first few months of life or till they're weaned. These antibodies are effective immediately but only offer temporary protection because no memory is established. Passive artificial immunity happens when we inject antibodies from a person or an animal into another person. An example is the administration of a rabies anti-serum or snake anti-venom. These will provide short-term protection. I would look at these chart, look at the examples, and make sure that you understand how different types of immunity are acquired. The occurrence of many infectious diseases such as polio and measles has declined where vaccination rates have been high, creating herd immunity, a phenomenon where a high percentage of a population is vaccinated or has had the infection, decreasing the chances of getting it and spreading it. Emerging infectious diseases are those that are newly identified in a population, and re-emerging infectious diseases were previously under control, but not all individuals participate in immunization programs, so other outbreaks have occurred or continue to persist. An example is the re-emergence of measles in the United States. Re-emerging infectious diseases are on the rise due to globalization, drug resistance, and several other factors. Biological warfare and bioterrorism use biologic agents to attack civilians or military personnel. Concern continues about the possibility of bioterrorism using altered antigenic forms of common viruses or bacteria. Several countries currently contain things like smallpox and other things that they could definitely cause some sort of bioterrorism or some sort of difficult times for other countries with if they were to distribute it. It's important to recognize that the large outbreaks of diseases formerly controlled by vaccines may represent acts of bioterrorism, like smallpox. Skin, cornea, bone, kidneys, lung, heart, and bone marrow are among the most common transplants. Most transplants or grafts involve introduction of foreign tissue from one human, the donor, into the body of another human, known as an allograft. Because the genetic makeup of the cells is the same only in identical twins, it's difficult to complete successful transplants due to the fact that the immune system of the person receiving the organ responds to the HLA, or the human leukocyte antigen, and in that foreign tissue, and sometimes they will reject and destroy the graft tissue. Rejection involves a type 4 cell mediated hypersensitivity reaction and a humoral response, both of which cause inflammation and tissue necrosis, and the rejection process eventually will destroy the organ. Many times, transplanted organs must be replaced. The survival time of a transplant is increased when the human leukocyte antigen match is excellent. The donor is living, there's less risk of damage to the donor tissue, and immunosuppressive drugs are taken on a regular basis. One type of rejection occurs when the host or recipient's immune system rejects the graft. This is called host versus graft disease. This is a possibility with kidney transplants, and I would know these. Graft versus host disease occurs when the graft tissue contains T cells that attack the host cells. So let's go back again, okay? Host versus graft disease is a possibility in kidney transplants, and this is when the host's immune system rejects the graft or rejects the kidney. The graft versus host disease occurs when the graft tissue contains T cells that attack the host cells. Corneas and cartilage lack blood supply, so rejection is less of a problem with these transplanted tissues. In neonates and young infants, they can receive heart transplants from donors without a good tissue match. Rejection does not occur because the infant's immune system is not mature and does not respond to the foreign tissue. Rejection can occur at any time. In a hyperacute rejection, this happens immediately after the transplant, as soon as circulation to the site is reestablished. This is a great risk in people that have pre-existing antibodies from previous blood transfusions. The blood vessels are affected, resulting in a lack of blood flow to the transplanted tissue. An acute rejection, which usually develops after several weeks when the unmatched antigens cause a reaction. I would know these also. And a chronic or late rejection, and this occurs months or years with gradual degeneration of the blood vessels. I would also know these, okay? Allograft, this is when we transfer between members of the same species. human to human. Isograph would be identical twins. Autograph is from one part of our body to another part of our body. Okay. And then xenograph would be from a different species like a pig to a human. So I would know those. All right. You know that we really don't do treatments, but they would use immunosuppression to prevent the rejection. This is a lifetime thing once you get some sort of a transplant, usually. All right. And it's going to be like steroids, cyclosporine, azithromycin, and all these are going to cause immunosuppression. All right, these are different types of reactions, hypersensitivity reactions. We have type 1, which is IgE mediated hypersensitivity. Usually we see those in allergic reactions. Type 2, we're going to talk about these more. This is IgG mediated. Type 3, this is more of an immune complex mediated. So this is going to be something like serum sickness or glomerulonephritis, even rheumatoid arthritis or SLE, and then cell-mediated hypersensitivity. And that is going to be things like contact dermatitis. This is more of a delayed reaction, type 4. All right, and tubercular lesions. So hypersensitivity or allergic reactions stimulate an inflammatory response. There are 4 basic types. You should know these. Type 1 hypersensitivity is called immediate hypersensitivity because your body's response to the antigen occurs immediately or within just a few minutes of being exposed to it. Common cause of this is going to be like hay fever. The primary class of antibody here is going to be IgE. IgE for allergic reactions, type 1 hypersensitivity. Okay, and here we have the mast cells and the basophils. All right, so you know that's going to cause that release of histamine. All right, so primary principal compound involved in type 1 is the reaction to the histamine. In the worst case scenario, anaphylaxis can occur. This is a severe and potentially deadly allergic reaction when too many mast cells and basophils release their stuff, like all the histamines all over the body at the same time. Again, causes are going to be hay fever, allergic rhinitis. An allergic reaction in the nasal mucosa is going to lead to things like frequent sneezing, watery secretions from the nose, itching. It might be related to pollen in the air, so it could be seasonal. Some people are susceptible to multiple allergens like molds and dust, so they can have signs any time of the year. They can also have food allergies. If they do have a food allergy, most of the time the reaction we're going to see here is going to be in the mucosa of the digestive tract, leading to things like nausea, vomiting, or diarrhea. And in severe cases, hives can develop on the pharyngeal mucosa, obstruct the airway. So we have to watch for respiratory difficulty and any sort of allergic skin rash. Eczema or atopic dermatitis is a chronic skin condition. This skin rash can occur on the face, the trunk, or the extremities, and it's associated with certain foods, irritating fabrics, and a dry atmosphere. Asthma itself can result from an allergic response in the bronchial mucosa that interferes with the airflow. Frequently, a triad of atopic conditions, including hay fever, eczema, and asthma, will occur. All right, so this is showing the reaction, what's going to happen. Okay, so we have the anaphylactic reaction, histamine and histamine like substances are going to be released. You have the eosinophils here. Okay. Too many mast cells and basophils released, remember, are going to lead to the urticaria and the wheezing or the bronchospasms. Anaphylaxis, this is a severe life-threatening systemic hypersensitivity reaction. Here we'll have a decrease of blood pressure, and that's caused by that histamine being released, airway obstruction, severe hypoxia, and this could be caused by things like latex materials, insect stings, nuts, shellfish, certain drugs. Anaphylaxis is a severe life-threatening systemic hypersensitivity reaction resulting in decreased blood pressure, airway obstruction, and severe hypoxia. It's caused by exposure to things like latex, insect bites or stings, ingestion of nuts or shellfish, penicillin, local anesthesia. The reaction usually happens within a few minutes of the exposure. So other things that we'll see is difficulty breathing, coughing, itching or tingling, especially in the oral cavity, feeling weak, dizziness, fainting, a sense of fear or panic, edema around the eyes, the lips, the tongue, the hands, the feet, hives. They might collapse and they might lose consciousness. So in anaphylaxis, we have these large amounts of chemical mediators released from the mast cells into circulation quickly, and this causes general or systemic vasodilation with a sudden decrease in blood pressure. In the lungs, edema of the mucosa and constriction of the bronchi and bronchioles happens that causes obstruction of the airway. We'll have a lack of oxygen from the respiratory and circulation impairment, and this can lead to that loss of consciousness. The main difference between simple allergies and anaphylaxis is that anaphylaxis typically involves more than one system of the body, and it specifically involves the cardiorespiratory system. So in the picture here, you can see an example of what's happening there. This reaction is from a type 1 or an immediate hypersensitivity reaction. After the allergen is introduced in the body, the IgE antibodies are produced to fight the foreign molecules or the allergen, and that's going to stimulate the histamine, okay, and the other mediators from the mast cells. This is going to cause inflammation, all right, and recruit into inflammatory cells. That's going to lead to dilation in the vessels, edema, smooth muscle contraction, production of mucus, tissue injury, inflammation. All right, so what do we see on the client? Skin changes, itching, redness, drop in the blood pressure, hypotension, difficulty breathing due to the constricted airways, a weak pulse, nausea, vomiting, diarrhea, lightheadedness. Anaphylactic shock is a severe, rapidly progressing form of anaphylaxis that will be present with worsening and persistent hypotension, cold, clammy skin, decrease of urine output, loss of bowel control, loss of consciousness. And these people need immediately to be treated. Again, there's some of the symptoms we just talked about and why we talked about them. So manifestations of anaphylaxis include generalized itching or tingling sensation over the body, coughing, difficulty breathing, weakness, dizzy, fainting. I would know these. Edema can be observed around the eyes, the lips, the tongue, the hives or the urticaria on the skin. The person can collapse and lose consciousness here. All right, and then of course the treatment, epinephrine, and then oxygen. Okay, you need to prevent that airway from swelling. So here's what they're telling you here. You got to do one before you do the other. In type 2 hypersensitivity, often called cytotoxic hypersensitivity, the antigen is present on the cell membrane. Circulating IgG antibodies react with the antigen and cause destruction of the cell by phagocytosis or by releasing cytolytic enzymes related to the complement activation. An example of this reaction is the response to an incompatible blood transfusion. If a type B blood from a donor is added to the recipient's type A blood, the antigen antibody reaction will destroy the red blood cells or hemolysis in the type A blood. Another type of blood incompatibility involves the Rh factor, in which if the mom is born with Rh negative blood, her blood will not be compatible with the baby's if the baby had Rh positive. All right, so in that last example, that was also known as fetalis blastus, and that's fatal for the baby. All right, next we're going to talk about type 3 immune complex hypersensitivity. In this type of reaction, the antigen combines with the antibody and forms a complex that is then deposited into tissues in the walls of the blood vessels, and it activates the complement. This process causes inflammation and tissue destruction. A number of diseases are now thought to be caused by immune complexes, including things like glomerulonephritis and rheumatoid arthritis. Serum sickness refers to the systemic reaction that occurs when immune complex deposits occur in many tissues. An orthus reaction is a localized inflammatory and tissue necrosis that happens when an immune complex lodges in the blood vessel wall, causing vasculitis. One example is farmer's lung, a reaction to molds inhaled when an individual handles moldy plant matter. Type 4 cell-mediated or delayed hypersensitivity. This type of hypersensitivity is a delayed response by sensitized T lymphocytes to antigens, resulting in the release of lymphokines or other chemical mediators that cause an inflammatory response and destruction of the antigen. These skin reactions usually do not happen immediately after contact, but they usually take about 24 hours to develop. The TB test is an example. The Man2 skin test uses this mechanism to check for prior exposure to TB. Contact dermatitis, or an allergic skin rash, is caused by a type 4 reaction to direct contact with a chemical. Sometimes you see these in healthcare workers from the gloves. Also, metals such as nickel, which are frequently found in instruments or equipment used by healthcare professionals can trigger an immune response. Such sensitivities are usually indicated by the location of the rash, so usually it's margined off. The skin is red and pruritic, and the vesicles and a serous exudate may be present at the site for these types of reactions. Autoimmune disorders occur when the immune system cannot distinguish between itself and non-self antigens. The exact causes of autoimmune diseases or disorders are still unknown. A person can develop antibodies to their own cells or cellular material, and the antibodies then will attack the person's tissues. The term autoantibodies refers to antibodies formed against self-antigens. Some of these disorders affect single organs or tissues, such as Hashimoto thyroiditis, and some are generalized, like systemic lupus erythematosus. Other examples include rheumatic fever, myasthenia gravis, scleroderma, pernicious anemia, and Graves' disease or hyperthyroidism. Aging can lead to loss of tolerance to self-antigens. A genetic factor also appears to be involved in the autoimmune diseases, as evidenced by increases within the family. Systemic lupus erythematosus is a chronic inflammatory disease that affects a number of systems. The name of this systemic disorder comes from its characteristic facial rash, once called a wolf rash, but now referred to as a butterfly rash because it goes across the nose and the cheeks. This appears to be multifactorial and includes genetic, hormonal, and environmental factors. Certain drugs may cause a lupus-like syndrome, and that usually disappears when the drug is discontinued. Discoid lupus erythematosus is a less serious version of the disease, only affecting the skin. So here you can see a picture of that butterfly rash. Systemic lupus erythematosus is characterized by the presence of large numbers of circulating autoantibodies against DNA, platelets, erythrocytes, various nucleic acids, and other nuclear materials, and the presence of anti-nuclear antibodies. Common sites affected include kidneys, lungs, heart, brain, skin, joints, digestive tract. Lab data shows the presence of the autoantibodies, the presence of numerous ANAs, especially anti-DNA, as well as other antibodies in the serum. The clinical presentation varies greatly. Vasculitis or inflammation of the blood vessels develops in many organs, impairing blood supply to the tissue. The resulting ischemia leads to further inflammation and destruction of the tissue. Signs and symptoms vary because of organ involvement, but commonly include polyarthritis with swollen, painful joints, the butterfly rash, glomerulonephritis, Raynaud's phenomenon, vasospasms in the fingers and the toes, accompanied by pain. So these women will have arthralgia, fatigue, malaise, heart problems, polyuria. And here again, list your clinical manifestations. I would just take a close look at those. Immunodeficiency results in a compromised or absent immune system. Immunodeficiency results from loss of function, partial or total, of one or more components of the immune system, leading to an increased risk for infections and cancer. Primary deficiencies involve a basic developmental failure somewhere in the system, such as the bone marrow production of stem cells, the thymus, or the synthesis of autobodies. Many defects result from genetic or congenital abnormalities and are first noticed in infants or children. Examples include an inherited X-linked hypogammaglobulinemia, low antibody levels because of B-cell defects, or developmental defect known as DiGeorge syndrome, where we have hypoplasia of the thymus. Secondary or acquired immunodeficiency refers to loss of the immune response resulting from specific causes and may occur at any time during our life. Loss of the immune response can occur with infections, especially if they're viral, splenectomy or removal of the spleen, malnutrition or liver disease, hypoproteinemia, where we have a low protein level, use of immunosuppressive drugs in clients with organ transplants, radiation, and chemo for cancer treatment. Immunodeficiency predisposes patients to the development of opportunistic infections by normally harmless microorganisms. This can involve multiple organisms and be severe. These infections are difficult to treat successfully, and they often come from the resident flora of the body, for example, fungal or candidal infections of the mouth, referred to as thrush, of someone whose normal defenses are currently impaired. Sometimes severe life-threatening infections result from unusual organisms that are not normally pathogenic or disease-causing in a healthy person, such as Pneumocystis carinii. It's essential that prophylactic antimicrobial drugs or preventive antibiotics be administered to anyone in an immunodeficient state before undergoing an invasive procedure that carries an increased risk for organisms to enter the body. The immune-compromised host is vulnerable to microorganisms not usually considered harmful. These are known as opportunistic infections. AIDS is a chronic infectious disease caused by HIV. It destroys helper T lymphocytes, causing loss of the immune response and increased susceptibility to secondary infections and cancer. It's characterized by a prolonged latent period followed by a period of active infection. AIDS is the stage of active infection with marked clinical manifestations and multiple complications. A person may be HIV positive for many years before he or she develops AIDS. The infection may not be diagnosed in the early stages because of this latent asymptomatic period. This contributes to greater spread of the disease. If a client presents with an unusual infection, such as P. carinii pneumonia, or a cancer such as Kaposi sarcoma, deemed an AIDS indicator disease, and no other pathology, this often marks the presence of active HIV infection and signals the need for HIV testing. Currently, the greatest increase in cases of HIV infection is occurring in women either by heterosexual contact or by IV drug use. Infected women may also transmit the virus to a fetus in the uterus. The clinical effects of HIV infection vary among individuals, and differences are also apparent among men, women, and children. In the first phase, a few weeks after exposure, viral replication is rapid, and there may be mild, generalized flu-like symptoms such as a low fever, fatigue, arthralgia, and sore throat. These symptoms will disappear without treatment. Many people are asymptomatic. In the prolonged second or latent phase, many clients demonstrate no clinical signs, whereas some have generalized lymphadenopathy or enlarged lymph nodes, and it appears that viral replication is reduced during that time. There is an increased incidence of all cancers in people with AIDS, but unusual cancers are a marker for AIDS. Kaposi's sarcoma affects the skin, mucous membranes, and internal organs. Kaposi's sarcoma skin lesions appear purple or brown, are non-pruritic, painless patches that eventually become nodular. AIDS infection is shown when the CD4 positive T helper lymphocyte count is less than 200 cells per cubic millimeter of the blood. In an HIV positive individual, the virus is known to be in the body. There's no evidence of immunosuppression. In AIDS, we have marked clinical symptoms, multiple complications. The individual often identified as HIV positive before we discover the AIDS. So sometimes they'll be HIV positive for a long time, and then eventually it'll turn into AIDS. Current therapies start if the HIV infection is diagnosed in the early stage. During the first phase, a few weeks after exposure, viral replication is rapid, and there may be mild, generalized flu-like symptoms such as low fever, fatigue, arthralgia, and sore throat. These symptoms disappear without treatment. Many people are asymptomatic. I would know these stages and what the signs are for the development of AIDS. In the prolonged second or latent phase, many patients have no clinical signs, whereas some have generalized lymphadenopathy or enlarged lymph nodes. It appears that the viral replication is reduced during this time, and then the final acute stage is when the immune deficiency is evident, as marked by numerous serious complications. HIV type 1 or 2 is a retrovirus, which means that it has an RNA genome. The virus is a member of the subfamily lentivirus, so called because the infection develops slowly. HIV-1 is the major cause of AIDS in the United States. The virus primarily infects the CD4 positive T helper lymphocytes, leading to a decrease in the function and number of these cells, which play an essential role in both humoral and cell-mediated immune responses. Also, HIV attacks macrophages and central nervous system cells. At an early stage, the virus invades and multiplies in lymphoid tissue, the lymph nodes, the tonsils, the spleen, using these tissues as a reservoir for continued infection. So HIV, retrovirus, member of the subfamily lentivirus, HIV-1, major cause of AIDS in US and Europe, and HIV-2, major cause of AIDS in Central Africa. The virus is transmitted in body fluids such as blood, semen, and vaginal secretions. Blood contains the highest concentration of the virus, with semen being next. So the presence of the HIV infection can be determined using a blood test for HIV antibodies, using HIV antigen from recombinant HIV or from the enzyme-linked immunoabsorbent assay or ELISA for the primary test. The procedure in primary use today is a 3-stage process. Each stage involves specific immunoassay tests to determine the following: the presence of HIV-1, HIV-2, antigen antibody, differentiation, identification between HIV-1 and HIV-2 antibodies, a nucleic acid test used to confirm HIV-1 positivity and eliminate a false negative. So this slide shows some common effects of AIDS. I would just look at it so that you're familiar with what those are. Clinical signs and symptoms. Generalized effects include lymphadenopathy, fatigue, weakness, headache, arthralgia, GI complications, and those are mostly due to the opportunistic infections, so like that thrush in the esophagus. Encephalopathy, sometimes called AIDS dementia, where we have an infection of the brain cells from the HIV. Secondary infections are common with AIDS, and they're usually the primary cause of death. They're frequently multiple, and they're usually more extensive and severe than usual. Drug treatment on the secondary infection is usually not that effective. So here we see some causes of secondary infections. All right, the pneumocystis carinii, that's a type of pneumonia. Herpes simplex, candida with the mouth and the esophagus, and then TB. And there's a picture of the esophagitis with the fungal infection there. There's an increased incidence of all cancers in people with AIDS, but unusual cancers are a marker for AIDS. Kaposi's sarcoma affects the skin, the mucous membranes, and the internal organs. Kaposi's sarcoma skin lesions appear purple or brown, and they're not really itchy. The painless patches eventually become nodular. Non-Hodgkin's lymphomas are another frequent form of malignancy in the AIDS patient. There's some pictures for you of the Kaposi's sarcoma in the mouth and on the back. And then our treatment, which again, you guys aren't being tested on treatments, but here they go. All right, there you go. That's chapter 7.